Hey, my name is Emily Ramsey. I'm a nurse practitioner student at Auburn University, and today I'm going to talk to you about insomnia. Insomnia is a common sleep disorder that can make it hard to fall asleep, hard to stay asleep, or can cause you to wake up too early and not be able to fall back asleep. And you may still feel really tired when you wake up. It is one of the most common symptoms for which adults seek medical advice. Sleep is a strong and highly regulated biologic drive, and the ability to fall asleep at the desired time and maintain sleep without excessive waking is fragile, and it's influenced by multiple factors. Some risk factors of insomnia include a family history, psychological factors such as anxiety or depression, smoking, alcohol, or caffeine intake, stressful life events such as divorce, financial situations, or work-related worries, and restless leg syndrome is also a risk factor. Patients with insomnia have poor sleep habits, unrealistic expectations of sleep, and inappropriate attributions about insomnia. Some of the following questions can be asked in determining the consistency of the insomnia. What time do you lay down and go to sleep every night? And are you sleepy at this time? Bedtime attempts should only occur when the patient is sleepy. Do you nap and doze off during the day or evening? This should be avoided to maximize sleep at night. Do you have any anxiety regarding sleeplessness at any attempt in sleeping? Substantial anxiety, if it's present, then methods should be taken to reduce that anxiety. So physical assessment findings of insomnia typically won't find too many physical assessment findings. It's a clinical diagnosis based on detailed sleep history, which includes number and durations of awakening, durations of problem, and sleep habits. So these patients really need to be keeping a diary to monitor and track when they have these insomnia episodes. One or more of the following could be present on diagnosis: fatigue, reduced energy, difficulty concentrating, impaired social and family interactions, daytime sleepiness, and sleep dissatisfaction. Also, one or more of the following could be present: difficulty initiating sleep or maintaining sleep, waking up early with the inability to return to sleep. It cannot be explained by lack of time or circumstances for sleep. Sleep disturbance must occur at least 3 times weekly, and intermittent but persistent problems with sleep that last less than 3 months. So those are some findings upon assessment that the patient may report. So the goal of treatment is to improve sleep quality, quantity, and repair daytime sleepiness. Some non-pharmacologic measures for treatment is to limit the daytime naps, limit your intake of alcohol, caffeine, and smoking, relaxation therapy, sleep restriction, and cognitive behavioral therapy for insomnia is also an option. The focus for treatment should be on non-pharmacologic treatment measures. However, there are some pharmacologic treatment measures. Lorazepam, 0.5 milligrams nightly. It can cause dizziness or headaches. Temazepam, 7.5 to 15 milligrams nightly. It can cause hypotension, blurred vision, forgetfulness, confusion, slurred speech, and rebound insomnia. The third one is also used for insomnia characterized by middle of the night awakening with the difficulty to fall back asleep. And then Benadryl is also a treatment option that the patient may use, and it doesn't produce any dependency. And all these medications are for short-term use only. So 3 priority teaching components for insomnia include: remind the patient, do not smoke or drink alcohol. Caffeine needs to be limited, little to none if possible. Insomnia is a clinical diagnosis, and therefore treatment response is based on the history of the patient and self-report. So it is very important that the patient keeps a diary, because some patients only remember the nights of insomnia when they sleep poorly. And remember that pharmacology treatments are for short-term use only, and the non-pharmacologic measures should be taken prior to starting a medication regimen. And those are my references. Thank you for letting me talk to you today about insomnia.